Chill,
Vern,
and Becca. And you know what?
Rehab to talk about
physical therapy,
occupational therapy,
and speech and language pathology.
join us on our first ever episode of Rehab to Talk.
A podcast series about the rehabilitation team.
brought to you by the Medical City Physical Medicine and Rehabilitation Department.
Here, we doff the scrubs.
Come together to discuss relevant topics to rehabilitation.
And take interprofessional collaboration out of the clinic and into the studio.
Today, we are so honored to be joined by the chairman of the department,
A physiatrist since 1994.
Our ever optimistic and kind-hearted leader, Dr. Bonifacio S. Rafanan.
Hello.
Hello,
Hi,
Doc.
Doc.
Hi. Good day, and thank you very much for inviting me for this first ever broadcast.
Thank
Thank
you
you.
so much.
Thank
We
you,
know
Doc.
you're
We're-
busy.
Thank you for answering our call.
We are
Okay.
so honored to have you here.
And my pleasure too.
Okay, so once again, welcome everyone to our first ever episode, pilot episode to guys, of this new series, and what a great event to kick it off on. December 3, the International Day of Persons with Disability.
You know, being a rehabilitation team, we work hand in hand with many persons with disability and their families.
And that's why maybe for our very first point of discussion, let's first define, right? Who is this person with disability? Let's talk about who they are and what exactly is a disability. I think, Doc Raf, you'd be the perfect person to enlighten us about that.
Well, thank you very much. Well, a person with disability is, by the term disability, is the patient is unable to actually do the normal daily activities, right? So, if a person having lower back pain and has problems in getting up, going to the bathroom, that is in fact already considered a disability. But these are what we consider relatively temporary disability. So anything that the person is unable to do in a normal way, we consider that as disability. Some would always put it in a context of differently able, right? Because some patients would probably able to do certain tasks, but in a different way, not just like the normal things that, of course, persons without any medical problems or physical impairment will have, of course, would do things, no? So that is what we always consider. A disability is a person who have difficulty in doing the normal tasks, the basic daily activities of a normal person. So it's a relatively a general term that we make use of. Some would always put it in a different context, right? So there are different forms of disabilities. Okay, we have disabilities coming from physical problems, right? We have like disabilities mental,
Yes.
developmental. So children would have, of course, some behavioral problems and even some developmental problems. Could be considered a person with disability. Of course, the other medical concerns would be those who have blindness, right? Loss of hearing, loss of speech, and even persons with possibly, of course, some psychiatric problems will be considered persons with disability. So disability has a big scope, right? But in our practice, we focus more on the physical disabilities. Yes.
You know what's interesting, Doc Raf? Before this, I just want to share, we actually did some research for the podcast. And it's like hearing you define disability. It's like me rereading.
It's so
the-
straightforward.
Yes,
Yeah.
on everything.
Right.
Is Doc Raf United Nations? Everything is, it's like I remember
That's right.
everything is it's
Yes.
the same thing.
Mm-mm.
Amazing.
So, well, actually, that's the reason why at times, so if you're unable to do your normal daily activities, it is actually considered a disability, right? But this may be something temporary, and that's where physical medicine and rehabilitation, the team will be, of course, will have a very active role in terms of putting these patients back to the highest functional capacity. At the same time, is if they're not able to go back to the normal way of doing things, is we will do it differently, right?
Yes.
And as such, that's the reason why patients with disability are also patients with a different ability. Right?
That's true.
Yes.
That's true. We like to say in OT that when there's the term dysfunction, we want to find the fun in it. So there's always the stigma, right, with PWDs that disability, it sounds very heavy, it sounds very negative, but I like what you said that they are actually differently abled, and um, even even some disabilities cannot be seen, right?
right.
Like you
Yeah.
mentioned, the mental and the cognitive disabilities.
Yes. So that's the reason why you cannot judge a book by its cover,
That's true.
right? So we see a lot of persons with disability cards, right? Okay, but that's a different issue, though, right? But we just have to actually take it, right? We don't know what exactly is going on that person, and we just have to accept if they are disabled, then they are disabled, right?
I think that's a really good topic to be raising, especially with the International Day of Persons with Disabilities coming up. Given that we can all be sensitive, especially because we don't know exactly what someone's going through, if it's a disability that's easier to see or more difficult to see. And I like how you were talking about the role of the physiatrist in um, uh, people with disabilities. Doc, would you agree that the Physical Medicine and Rehabilitation Department, I feel like we have a really big role to play in persons with disabilities? Would you agree? What can you say about
Well,
that?
definitely.
Yeah.
And I would even possibly consider that as an understatement.
You gotta
So,
make it
yeah,
higher.
yeah, make it higher, right? And we know physical medicine and rehabilitation, it's not just simply the physiatrist, like the doctors involved, right? We are a multidisciplinary, so there is always collaboration between the different teams of the rehab, right? And of course, who else can actually say no to these beautiful ladies here? Okay, so if these are our therapists working with you,
Yeah.
I think you will get better soon. Right? So yeah, so physical medicine and rehabilitation works together. Or actually, it's a collaborative team. It's a multidisciplinary team. Okay, we have our specific roles when it comes now to, of course, what we can do for our patients,
Right.
right? So, and that is something that, as a very good team will have, is that the respect for each other's roles and responsibilities, and in terms of making our patients' lives much, much better.
Okay, I
Yes.
do think it's already time to meet the team that we just
Yeah,
introduced.
the one that Doc Raff was just talking about.
Okay, so
Now that we've shed light on the actual people who live with disabilities, we've defined what a disability is, being differently abled and such, and how these people continue to overcome their day-to-day struggles, as I said, being differently abled, let's now talk about the ones who play a big role in helping them maximize their potential. So, all the rehab team, so all of us, we've been saying that over and over again for the past few seconds, minutes, I don't know anymore, of our show. So, your physiatrist, PT, OT, and
Speech.
Yes.
Speech
Okay.
therapist.
And it is not just exclusively for the all four. We have other members of the rehab team that will also have their respective roles in, of course, managing our patients with persons with disabilities.
Yes, hopefully we can meet them soon. We need a bigger couch.
yeah.
We can meet them soon, maybe in the next episode.
Maybe we'll make
Maybe
this
we'll give them a place. Why don't we start with physical therapists?
First off, the physiatrist.
Oh, okay, that's me, right? Okay. Well, I'm one of the physiatrists, of course, in our hospital. And of course, what will be our role? Well, as a medical practitioner, right, so we evaluate our patients as to, of course, the medical problems that they may actually have been experiencing, and what will be the impact of these medical problems when it comes to their functioning. And as such, we look into the rehabilitation problems that the patient might actually encounter. And after the evaluation and, of course, assessment of a patient, is that we either determine if their patient will significantly benefit from the different, of course, team members that is part of our rehabilitation medicine team. So what we do is we determine whether, of course, our patients will benefit from having physical therapy, occupational therapy, and speech treatments, right? So, and if there are other, like for example, if we need to put them on braces, so we refer them to the orthotist, prosthetist. If we need to have some psychological, of course, counseling, then we refer them to our psychologist, right? So we have a big team that can actually help in the rehabilitation of our patient. So I will be, of course, my role will be more of collaborating, of course, with our rehab team in trying to, of course, put our patient back to her or his highest functional capacity, right? So, and that's the reason why, of course, you are here because, as a physiatrist, my role will be, of course, very limiting without you guys.
Right? And
You start crying.
Okay.
Iyak ka na pala.
Wow.
Okay.
And one of the many people that Doc Raf as a physiatrist collaborate with is the physical therapist. And that's Ma'am Vern right there. And it's such a great thing that now everyone in the Philippines knows what a PT is. Yan, alam na alam yan. And so, Ma'am Vern, could you tell us, could you shed light on what is your role and responsibilities with PWDs?
So mostly, us physical therapists, sometimes we get, how do you say this? Napagkakamalan in English. Sometimes people
Mistaken
think,
as.
they're mistaken as massahistas.
Okay.
Yes. But that's another conversation for the next podcast episode probably. But that aside, us PTs with persons with disabilities, we are also known as movement experts. So it is our task to help these people, just what Doc Raf said, reach their most the most independent that they could be in terms of movement. So the questions like, can you transfer from your bed, your wheelchair independently? When waking up in the morning, can you stand up by yourself, or would you have to have someone with you to help you stand? It's like the common thing, especially during inpatient or like the ones that are confined. Sometimes with movement, it's easier to just carry someone, but you won't have someone to carry you all the time. So we really try to advocate. That's another part of what a physical therapist does. We try to advocate for persons with disabilities to be as independent as much as they can, even if they have to use assistive devices. So we have one beside me and also beside Ma'am Chill. If they have to use assistive devices just so that they could be able to move about on their own, even in their own house, that's already a big thing. I actually have a lot of patients who say, oh, before when moving around the house, somebody needs to watch over me all the time. But now, sometimes I don't even use my walker. But they say, oh, but I still use it outside when going to the malls, and that's okay. The important thing is, at least at your own home, you're independent. You can do the things that, simply going to the restroom. You don't have to ask for someone to help you. Can you please go with me to the restroom and stuff? And of course, another role that we have as physical therapists, aside from teaching mobility, like how to walk, how to stand, how to do transfers from one chair to another, or from, as I said a while ago, bed to wheelchair. Another way is we also treat if there is any pain. So pain is very debilitating for some. That's why what Doc Kraft said a while ago with low back pain. Some people think, oh, it's just low back pain. It's not. It's not. Probably not a disability. But we actually have patients who are considered disabled because they cannot go to work anymore because of how intense their low back pain is, and that's already considered a disability, albeit temporary. But it's still they're gonna be differently able because they won't be able to do their normal, typical day-to-day tasks. So in that case, we also help in managing the pain, aside from strengthening and conditioning the body, so that they would be, as what I always like to say, your body would be built or strong enough to do the things that you need to do.
That's right.
Because again, at the end of the day, we really want to advocate for their independence, and we really want them to be the ones who do the things that they need to do. You know, it's the small things that sometimes when they progress, oh, ma'am, I can wear my shirt now. You know, I can you know, our gowns here. I can tie my gown already. Like those small things.
Yeah.
Or you know, I walked with a hemi walker on my own for with just my caregiver or my family member just watched me do it. So, you know,
Right.
it's those
Yeah.
small things that persons with disabilities, and that's what we help them with as physical therapists.
Yes, I completely agree. In fact, part of of course, as a physiatrist, is I really refer a lot of my patients for physical therapy, and we make use of exercises, in trying to, of course, improve the function of our patients, right? And of course, in terms of course, the experts in doing the exercises, in teaching the patient the right way to do things, right? We have our physical therapists to help us out. It's also very important that, of course, as mentioned, we make use of certain physical modalities, not necessarily just for enhancement, of course, of function, but definitely also for alleviation of pain, right? So we know that some of our patients are too afraid to take oral medications, right? And they will always try to prefer some non-medical treatment or non-pharmacological, as we call it, in terms of managing their pain. And definitely our physiotherapists will be of very big help when it comes to alleviating the pain. So when it comes to exercise, you know where to go, to our physiotherapist, right? When it comes to some pharmacologic treatments, right, for pain, then we have also our physical therapist. So it's very big help to us and definitely to our patients, right? Okay, thank you.
So, as physical therapists, you know, the word collaboration a while ago was mentioned. We also work closely with occupational therapists. And although they are fewer in number,
We are.
yes, you are. They are very multifaceted on how they help our patients. And actually, one of my most favorite parts of treating inpatient, that's what I always tell you, is co-treating.
Yes.
And being able
So much fun.
to see how OTs or occupational therapists treat our patients. So, Ma'am Chill,
Hi, yes, we are.
Deep breath.
I-
Multifaceted.
We are
Many
multifaceted.
facets.
Too many that I don't know where to start. But our very function as OTs is to help our patients with their day-to-day activities, no matter what they are, no matter how menial they are, or how menial they are to us. Like once meaningful activity doesn't have to be
The same one that
the
you
same
have.
one that you have, something. So we want them to rejoin their friends, their families back into the activities that they love to do. So that activities that are meaningful for them. Like, for example, if it was a chef who recently had a stroke and they want to cook again, but they can't, we find a way around it. So these activities, these day-to-day tasks, we have a lot of them. They include activities of daily living, or ADLs, or instrumental activities of daily living, leisure, that's one. Rest and sleep, yes, that's an occupation that
Oh.
we forget. And
Learning
then
so much.
education and work participation. So anything that actually hinders them from participating actively in those, we help with. And it's us either helping them regain their lost skills, their lost function, if it can still be improved, but if not, we help them compensate or find a way around it. We help modify environments, we help modify working, their working cubicles, their work setup, ergonomics. We actually help more beyond the patient. We actually reach out. We do work evaluation. So there's a lot. There is a lot. And another thing that I'd like to raise is that here we do in this hospital, we do splinting as well. So for someone who needs to type but recently got into a finger injury due to basketball, they want to use their fingers again, right? So we help them immobilize their fingers and in a safe way so that they can use it again. So there's a lot. And with regards to treating with PT, we actually find them great partners in mobilizing and
Great partners.
mobilizing and waking up our patients.
Great partners in carrying.
Yes, because I
Thank you so
cannot
much.
carry alone. No man is an island. That's what we say in the rehab team. But also once they get their patients to balance in different positions like sitting or standing, then we can interject with, okay, you're sitting, now we're gonna cook.
Right.
You're sitting, now we're gonna type. You're standing, now let's reach for the grocery. Yan. So it really is a partner hand in hand thing.
Collaborative.
Yeah.
That's right.
Type of thing.
And one of the many activities of daily living is actually eating. Yeah, my favorite ADL. And
best
and actually we also help with training patients to swallow again. Something that we take for granted, but but actually it's very hard for some patients with tracheostomy, with stroke, with TBI. So another close friend of the OTs is actually the speech therapist,
friend. Woo!
the best friend. We love them so much because they help our patients find their voice, find their way of communicating to each other. So, Ma'am Becca, take it away.
Thank you. So, speech and language pathology is a very young profession, actually. So, not a lot of people know about speech and language pathology, but I feel like the cook is the example we've been giving. So, let's say if you're helping the cook to walk and get to the kitchen, and then you're helping the cook to make the meal, we're the ones that help you remember the recipe in sequence and verbalize it. Get me that, get me this. And so the speech and language pathologists, what we do, we're in charge of communication in all aspects. So it could be a person's language, or it could be a person's muscles that they use for talking. If you have slurred speech, it can also be cognitive. So, for example, something in your cognition was affected that affects your language. So, for example, attention or memory, things like that. We also intervene in social language. So, using pragmatics and using language in your culture. And so that's what we do. So, speech and language pathology, it's kind of the combination between science and art, because you have to clinically look into someone's communication and what's meaningful to them, but you also have to kind of read someone's mind and figure out what is it that you'd like to talk about, because that's what we're going to talk about. And so speech and language pathologists also intervene for things like stuttering, and also, as Ma'am Chil said, swallowing and dysphagia, because the muscles that we use for talking and speaking are very interconnected with the muscles for swallowing and eating. And intercollaboration with physical therapists and occupational therapists, it's so fruitful, because especially when you're in the hospital, you have to maximize those interactions for communication. So something that I teach a lot of my patients is when they're doing physical therapy, oh, so you can count on your own, you can do it. You can count, or if you're eating, to express like what is it that you'd like to eat. And trust me, when you teach someone to express what they want to eat, they will say it. They'll say, that doesn't taste good, or I like that instead. So that's speech and language pathology. It's communication and it's swallowing. And like I said, it's not a very well-known profession. I think it's important that people just ask what it is, because even I didn't know about speech and language pathology before I became one. And it's also a really, really helpful thing. For people with disabilities, we have a lot of the same population as
Yeah.
physical therapy and occupational therapy, but also others, kids, but that's a different kind of aspect. But yeah.
Yeah, and of course, sometimes people who are gay have difficulty just simply speaking out.
Mm.
Like, so we have a lot of like people from BPO who need their voice, and they end up having, of course, some hoarseness and everything.
Yeah, it's
Yeah.
very
Right.
common, Doc.
Very
yeah.
common. So, okay, our speech therapist will be, of course, in the best position to help them out. Definitely, our occupational therapist, okay, okay, in terms of function, like she already mentioned about ADLs, right? Activities of daily living, which more often than not is that we don't actually think about
That's
it,
right.
right? So, but these are very important facets of our lives that on our day-to-day activities, feeding is very important, okay? Perennial care is very important, right?
Yeah.
Okay, and of course, the personal hygiene and dressing, standing, sitting, transfers, those are the things that we commonly, of course, do things and we don't bother to actually think about. But persons with disabilities might have really difficulty in doing those very basic tasks. And as such, of course, our occupational therapists, with the help of our physical therapists, really would actually be of big help in helping our patients. Definitely, the speech therapist is not just regaining your voice, but of course, is that it's also some way of course, connecting again with your families, with your friends, right?
right.
Because communication is a very important aspect in our lives, right? And if you cannot verbalize or you cannot actually even accept some concepts, right? Then it's going to be very difficult for our patients. And that's the reason why, these people are very important, no? Our physical therapists, our occupational therapists, our speech therapists, in lending a hand to our patients, right? Not only lending, but even possibly giving a hand, right, to our patients to be the best that they can be in terms of their rehabilitation.
Yes, I just
Well said.
realized, I just realized that our roles is a big thing in making the lives of our patients, people with disability, to be more meaningful.
Yeah.
We help out their lives. It's not just about walking or just about moving, but it's also about, does this actually matter to you? And what
Yes.
matters to you, we will help you get there.
That's right.
Yes.
Yeah, it's described as a profession of hope. You know what I mean? When you go into the hospital, you may not exactly be the person who saves a person's life, like on an operating table, but
We're
you're
not
the
dramatic.
not for me, but you will provide hope in that way. I really like what you said, Doc Raff, about the people and what's meaningful to them, and for how that connects with speech and language pathology. Is I was just saying earlier, there are a lot of people who assume that speech therapists just make people talk again, but really, what's really meaningful is different for everyone. Just like Mom Chill said earlier, you may be surprised that someone who is relearning how to speak again, the first thing they want to talk about is not what you would expect. It might be, how's my daughter doing in school? Did someone feed my dog at home? Or it could be literally remembering the prayer that you always pray, the recipe that you like to cook, and so yeah, I think that's very, very significant for persons with disabilities, which we're going to talk about right now. I feel like we've talked a lot about the team behind these very special people in our lives. So what about this person with disability, and how can we empower them, especially in our culture, even when they're still in the hospital? Because a lot of the time we see our clients or our patients when they're in the clinic. So what can we do to further empower our patients even when they go home?
That's a good
do you
idea
think?
because our rehabilitation sessions, they're only 1 to 2 hours max, and so it does bring us to reflect on like what's happening with the other 23, 22 hours of the day, right?
Yes, it begs to question, are the things that we teach our patients, are they actually able to apply this at home? Are they actually able to bring this to work? And stuff like that.
Okay. Well, for me, what is very important is, as we all know, being part of the team is that, okay, we need to know what is the goal of our patients in terms of
Right.
really, okay, going back to whatever
Very
they want to
important.
do. So we have to, okay, customize, right, our, okay, program, our, okay, approaches when it comes now to the needs of our patients. So that is one way of empowering our patients is for us to help them achieve what they want to achieve, right? So it's also very important that, of course, as you already mentioned, educating them is very important,
That's
right?
true.
And of course, how do we educate them is by just telling them, of course, the things that they need to understand in their journey when it comes down to doing their rehabilitation. So it's very important that we need to connect with our patients as to their needs, such that, of course, if we can provide now, is that we will make a program for them.
That's true.
At the same time, is we can also tell them that, hey, it can also go beyond what your needs are,
That's
right?
right.
And that's something that, of course, okay, putting them, okay, giving them some enlightenment or giving them some hope, but of course, not giving false hope.
Yes,
Okay, it has to
that's
be something
important.
realistic that our patients can be able to actually do,
That's
right? So that's the best thing to do is connect with them. Let us find out what they really wanted to do in their lives, okay? How what they want to achieve. We will tell them whether, of course, this is doable or
Yeah.
it's something very much okay we can do, and if not, then there are other ways to actually go around it, right?
Yes.
So I think that's one way of telling our patients you are empowered because you take the lead in guiding us as how to help you.
That's
Right.
that's so true. Wow, that deserves a round of
Makes me want to
applause.
stand up.
Yeah, I was
Yeah.
about
That's
to say.
okay.
But,
That's so true.
And I'd like to add, not just to connect with the person with disability, let's connect also with the people around them.
Very
With
true.
every session, there's always a loved one that comes with them to accompany them, and we actually in OT we take it to heart that we always involve the caregivers in the simulation of activities of daily living, like ito po yung gagawin niyo sa bahay, right? And we always let them take, front row seats to what can be done at home. Because like I said, 22 hours a day na wala tayo, na we're not there, they also have to take responsibility for their loved one, right? And when it's like, when they're, when the relatives, it's always fun to see them more informed. Actually, like they become experts in their own
That's right.
loved ones' conditions. They can already tell us things about, like, oh, ito yung ginagawa ni patient sa bahay.
They give you the update
That's
before you
right.
even ask
Update.
for it.
And it's
That's
always
right.
such a beautiful, collaborating process with the caregivers, the patient, and us. Like, it's not just us; it's also them.
And that's basically, of course, one important aspect that we have to realize that when we talk about the rehabilitation medicine team or physical medicine rehab, it's always going to be the patient and the family as being the center of things,
Yes.
right? So, okay, definitely we need them in terms of helping, of course, our patients go back. That's a very important aspect that, of course, the family should be involved, right? So, or the people that loves the person should be very much involved because their support will be very, very important and even crucial to the recovery of our patients.
That's
Yes.
right.
Having a good support system is actually a big motivating factor. It's a very good prognosticating. Sorry.
Yes.
It's a very good factor that
Yeah.
will say, okay, this patient will really develop or will really
Achieve their
improve.
goals.
Yes,
Yeah.
and
Okay.
achieve their goals.
I really like
So,
that. Yeah.
The
Okay.
social environment in which our persons with disabilities are part of is integral to the quality of life. A good support system, as I said a while ago,
Yeah.
it goes a long, long way.
Yes.
I really like that call to action because I always tell my patients that communication is two-way. So here
Yes.
you're here in you're here in the clinic, you're practicing how you're talking, how you're slowing down, etc. And then they'll say to me, but I don't want to talk at home because people rush me. And then I say, tell them not to rush you.
Okay.
Communication is two-way, and I think that's a great call to action for all of us because as a society, we are also playing a part in how we build a world or environment for our people with disabilities, right? So it's also on us to make sure that we are playing our role in that two-way street,
Yeah.
right?
It's like you said, it's up to us in how we model, how we involve the patient. If they see us involving the patient in the activities, they see us also, they can also replicate that at home. That our person with disability won't be left out of important family functions, important household chores, and they would actually feel like a very productive member of the community.
That's right.
So that was a very rich conversation. That was a
Yeah.
very
I
rich
think it just
discussion.
opened
Yeah.
something.
And that's true. So now we come to realize there's a very big scope, right, of what rehabilitation medicine, physical medicine, and rehabilitation team can actually do for the patients. And it just gives them, our patients, more hope, more aspiration when it comes now to achieving, of course, what they want to do further in their lives. As we always say, right, we always try to provide the quality of life, and providing it with the quality of care coming from the rehabilitation team. So it's a big thing, right? So, and it's a tall order for us, our rehab team, to really make sure that our patients are doing well.
Yes, that's true. And actually, this is the first time we've talked down and sit down and talked about this, and we don't do this very often.
No.
I only see you upstairs or in rooms or in passing.
Say hi.
Yes, and we every day we treat our patients in the rooms or in the center from 7 to 7 and see them come, get treated, and get discharged.
Yes.
In each of our own ways, we get to empower patients with disabilities, but we also get empowered in return.
That's
it's not
so
just a one-way
true.
street.
Yes.
We also learn a lot from them, and we also find a lot of new ways to work together. All of us,
Yes.
along with our patients and their families, new ways to help each other, ultimately for our patients. So we've got a great team here.
That's right. We do have a great team here. And just like you said, I think the thing that keeps us inspired, that keeps us going, is the patients. Because they provide us so much inspiration and empower us so much in return. So if you want to learn more about the services that we offer, feel free to please visit us at the Physical Medicine and Rehabilitation Department at the Medical City. You can also call the number 6240-6241. That's our local number. And we would love to actually answer any questions that you have if you call our number or visit us. And we're also going to answer some questions right now with this Q&A.
We talked, we discussed, and we conquered. That's it for our first ever episode of this video podcast series. Thanks for joining us at Rehab to Talk. I'm Chill, your occupational therapist.
I'm Vern, your physical therapist.
And I'm Becca, your speech and language pathologist. Thank you again, Dr. Raf,
Thank
for
you very
gracing
much.
us with your presence, your expertise. And actually, would you like to do the honors? We will all say thanks for tuning in, too.
Okay.
And then you can say Rehab to Talk.
Yes.
Okay?
Okay.
Are we ready with our podcast voices? Okay.
Thanks for tuning in to
Rehab to Talk.
Okay, brought to you by the Medical City Physical Medicine and Rehabilitation Center.
Here we doff the scrubs.
Come together to discuss relevant topics to rehabilitation.
and take interprofessional collaboration out of the clinic and into the studio. Goodbye!